In the meantime, cases in children have surged over the last month from around 38,000 at the end of July, more than 180,000 just last week. That's according to the American Academy of Pediatrics. In Mississippi, the governor has called in about 1,000 extra healthcare workers to reinforce 61 short-staffed hospitals. Mark Strassmann is in Jackson with more on the story. Mark, good morning to you. This is very troubling.
Very troubling, Gayle. Good morning to you. This is St. Dominic's Hospital in Jackson, clobbered by COVID the last 5 weeks. All 64 ICU beds are full, more than half by COVID patients. This week, they're setting up that tent you see behind me to screen and test overflow patients for the virus. But one of the most worrisome trends throughout this state is the Delta variant's impact on kids. 3 weeks into Mississippi's school year, COVID's toll on kids is staggering. Almost 12,000 students have tested positive, with nearly 29,000 now quarantined. Sadder still, Michaela Robinson's COVID story.
That was my only daughter, my only child.
Justin Waddell is Michaela's father. The 13-year-old 8th grader started feeling sick on Wednesday, August 11th. She died from COVID that Saturday.
We never seen nothing happen like this in 3 days. It was a shock to everybody, the whole family.
In Mississippi, barely 1 of every 3 people has been fully vaccinated, the country's second lowest state rate.
I have no intention of issuing a vaccine mandate, period.
Governor Tate Reeves also opposes mask mandates, even in schools, despite a COVID surge that has alarmed many parents and doctors. Pediatrician Dr. Anita Henderson works at the Hattiesburg Clinic. She describes COVID's impact on kids here as a freight train.
And what I mean by a freight train is our clinics are overrun.
And what would you say to people who say, they're young, they'll be fine?
We're seeing that in our pediatric population, kids who can't play the flute anymore, kids who can't participate in sports anymore, and that's heartbreaking.
Worrisome to Henderson, more than half of this state's 82 counties have no pediatricians. Little Shelby Davian got lucky. She spent nearly 2 weeks in the ICU after developing multi-infection syndrome for children, a rare but dangerous condition that can appear after a COVID-19 infection.
The staff told us she's a miracle, that she was that sick and that she was one of the worst they had seen.
This hospital is among those getting the governor's reinforcements. 20 paramedics could show up as soon as today to help screen and test COVID patients. But what this hospital could use, like all hospitals throughout this state, is a break from this viral siege. Anthony?
Yeah, as Dr. Henderson said, COVID is a freight train. Thank you, Mark.